Hello, good evening, and welcome to another session of Ask the Doctors. How are you? Today is Sunday, the 10th of the 29th of October 2023, and the time is 8 p.m. here in Lagos, Nigeria. How are you? And where are you watching me from? Now, the Ask the Doctors program is a health program where we talk about health, we answer questions, we invite guests on the program to talk to you. However, today we are talking about arthritis. Today we are talking about arthritis, and a lot of people have been asking us questions. So we decided that we're going to talk about arthritis. My name is Frederick Unubohai, and I'm the host of the program. My co-host is Dr. Israel Irobonose. Now, if you can hear me, tell me where are you watching me from? Okay, I see you. Good evening. Adedeji, good evening. I see you. Abubakar, good evening. How are you? Victor, good evening, Mr. Victor. Good evening, sir. Yes, good life now, sense. From Lagos, okay. Jenny, hello. How are you doing, ma? Let's see, who do we have here? Anne Gabriel, watching from Kaduna. Okay. Evelyn. Evelyn is watching us on YouTube. Yes, we are live on Facebook and we are also live on YouTube. Evelyn, how are you? Okay, Abubakar is watching us from Ogbomoso. Yakubu. I think this is Yakubu Jemilat. Yes, good evening, everybody. Welcome. Now, tonight we're talking about arthritis. And a lot of people have been asking us questions about arthritis. So we decided that let's just give you a brief basic knowledge, understanding of arthritis. But please remember that on this program, we don't prescribe medications, we don't treat. All we do here is we educate you, we encourage you to go see your doctor wherever you are. Is that okay? Yes. We have Obiageli here. Chinyenye, good evening. Inkiru, good evening. Laurencia, watching us from the UK. Now, when you hear the word arthritis, what comes to your mind? Tell me. When you hear the word arthritis, everybody in the comment section, tell me, what comes to your mind? Yeah, let's go. Don't forget to like and share. If you are watching on YouTube, share, like. Don't forget to also subscribe on YouTube. So when you hear the word arthritis, everybody, tell me what comes to your mind. Don't check Google. Don't spy. Or yeah, put in the comment section. I'm waiting. I want to hear from you. When you hear the word arthritis, what comes to your mind? Oh yeah, tell me quickly. I'm waiting for you. We are chatting together. My co-host is Dr. Israel. I'm hoping that he joins us tonight. Oh yeah, now watching from Jos. Ada. Okay, Ada, I see you. When you hear the word arthritis, what comes to your mind? Okay, Afiz says a severe body pain. Okay, let's see. Who else again? Tell me, when you hear the word arthritis, what do you understand? What comes to your mind? What do you think we're talking about? Oh yeah, tell me. Tell me. I'm waiting for you. I'm waiting for your comment. If you don't tell me, then okay. Let's see. So I want to show you something here. Everybody, let's see if I can show this to you. Is this okay here? Okay, this should be better. Okay, good. Good evening, Juliet Richard on YouTube. Juliet is watching me on YouTube. Juliet, how are you? Oh yeah, nobody is responding. Okay, I want to show you something on my screen. Let me share my screen, everybody. Let's see. You can see my screen. Okay, good. Now look at the screen. I hope swelling of the legs. Okay. Let's see if you can see my screen. Okay, good. Can you see what is on the screen? Okay, I think this is great. Can you all see what is on the screen? If you can see my screen, say yes, I can see you. Quickly. Yes, I can see. Okay, so whenever we mention arthritis, arthritis is a disorder, problem, medical challenge, sickness of your joints. What did I say? Your joints. Arthritis does not mean you have body pain. Arthritis means there is a problem in your joints. Everybody. So when we are talking about arthritis, arthritis is a medical disorder affecting your joints, and you have joints in almost every part of your body. So you have joints in your spine, your hands, your elbow, your shoulder, your knee, your hip. So anywhere you have the joints, that joint can get affected. And when it gets affected, you can develop arthritis. Is that okay? Now, on your screen, there is a joint on your screen. These joints, we have one bone and another bone. Where two bones meet is called a joint. And inside that joint, you have a lot of things. So look at your screen very well. Now, on your screen, you can see one bone. Oh, this one is too big for you. Okay. On your screen, you can see something here. Okay. Cartilage. You can see synovial membrane, sockets, and see your joint head. So when any of these things in your joints get affected, you develop arthritis. And you can have different types of arthritis. We have so many types of arthritis. People just wake up and say, Doctor, I have arthritis. So, and when you ask them, what type of arthritis do you have? Say, I don't know. I just know I have arthritis. So there are different types of arthritis. Number one, arthritis can affect children. Arthritis can affect elderly people. Are we together? If you are with me, say yes, I can hear you. If you are with me, just say yes, I can hear you. If you are on YouTube, comment, let me see you. Let's see. Okay, I can see you all here watching. Good, good, good. So arthritis affects your joints. There are different types of arthritis, number one. Number two, arthritis can affect any age. If you can hear me, say yes, I can hear you. Okay, very good. Yes, I can hear you. Okay. Now, when we now mention arthritis, okay, Dr. Israel is here. We're talking about, let's see, is Dr. Israel in the house? Okay, Dr. Israel is in the house. Yes, welcome. So when we say somebody has developed arthritis, we mean that the person has developed problems affecting his or her joints. Now, I want to show you another picture of a joint that has been affected by arthritis. Yes, I can hear you. Very good. What's happened to my network? Okay. Now, this one will be clear to everybody here. Let me show you. Dr. Israel, good evening. How are you today?
Good evening. Happy Sunday.
Yeah, happy Sunday. Welcome. Okay. So before you came, Dr. Israel, I already defined what arthritis is, and then I have to show us the pictures of the joints. Now, everybody understand by the word arthritis. Somebody say, body pain, joint, no, swollen legs, and somebody else said knee pain. And I made you understand that. Look at this picture on your screen, everybody. There's a picture on your screen. Before I hand over quickly again to Dr. Israel to break it down for us, you can see the normal joints, and you can see something here. And I mentioned to you in the very beginning that there are different types of arthritis. Arthritis can affect any age. Have different types of arthritis: osteoarthritis, rheumatoid arthritis, idiopathic juvenile arthritis, gout, ankylosing spondylitis, reactive arthritis, septic arthritis, so many types of arthritis. But in this discussion today, as I hand over to Dr. Israel, we'll just give a basic understanding of what arthritis is. So, Dr. Israel, over to you.
Oh, thank you. You've given them the different type of arthritis.
Yes,
And I
yes.
believe so you don't even define arthritis, which you said you've done, and that
Mm.
is disease of the joints. Down are just like a simple thing that you need to know. disease that
Mm.
affect the joint. Dr. Fred, show you the hear me well.
Yeah, yes, I can hear you. I can hear you. I can hear you.
Okay, okay. So also it fit be like an inflammation. Sometimes inflammation fit happen for the joint. So
Mm.
these are
Mm.
just wetin arthritis be, and sometimes any change for the joint is also can can be arthritis. And arthritis, as we said, we mentioned different type of arthritis, and it's just for you to know say arthritis can affect any part when joint dey, mostly the movable
Okay.
joints
Doctor,
like the feet.
Dr. Israel, your network is breaking up. I don't know if it's from my end, but your network is breaking up. Um, I don't know if you all can hear Dr. Israel, but if you can hear him clear, just let me know. Dr. Israel. Okay. Yeah, continue, please.
Okay,
Hello. Can
you
you
say
hear
they
me?
can hear me clearly.
Yes. Yeah, go ahead. Go ahead.
Yeah, I can hear you, Dr. Fred. Can you hear me? Okay, it be like saying that your
Yes.
network. Okay, as I was saying,
Oh, yeah, now.
I say arthritis go fit affect the feet, go fit affect the hand, it can affect the hip, knee, and it can also affect the lower back. Eh? And I know say Dr. Fred already give us different type of arthritis. So one of the commonest, the most commonest of all the arthritis sometimes now the osteoarthritis and sometimes the rheumatoid um, and the rheumatoid arthritis. And the osteoarthritis is mainly like a wear and tear. Eh? So our arthritis they form, for the joint, we get some things where they cover joint and where two bones for meat. But these two bones not just they jump together, because if they jump together, now they cause pain, now be the arthritis. So what they happen is that for the head of this joint of these bones, there are some things when cover them. Eh? There are some things when help to make sure say these bones, the rough part, not they hit themselves. They are like cartilage, and they cover the two edge, and they lubricate. There are also some fluid that help to lubricate those joints. Eh? When they the synovial, they call it the synovial fluid. So in a long run, after some long time, maybe sometimes for people will get disease state, or some people will don't injure their legs or their joints before. So these things go come dey reduce gradually, and when they reduce, you come expose the bone, and when the bone they meet the bone, now they cause this pain. Now, for some now, immuno uh, um they call this thing. Dr. Fred, help me out. Yeah, there's a word I'm looking at.
Autoimmune.
Okay, some
Autoimmune.
immune system now they attack. Yes, autoimmune issue. It means say the immune system, the normal immune system of the body, they attack or those synovial fluid, and as they attack them, you can't expose the bone to each other, and because when the bone jam each other, they will now become a friction. And when friction, when you dey scrape iron for ground for a long time, if you touch am, you dey hot. And I say they be, it means say these two bones when be two solid things don't jam together, and they do work. After some time, they come they cause pain. That's just like a simple way when we fit describe how arthritis take dey happen. Eh? How arthritis take dey happen. Why for okay, Dr. Fred.
Yeah, yeah. Continue. Dr. Israel,
Okay,
your network.
yeah,
Okay, continue, please.
okay. Now, so wetin come be the signs and symptoms when person fit know say uh, this one fit be this problem fit be arthritis. So some of the signs and symptoms when person fit get, mostly the first one are pain, and the person can have can have pain for the leg. And also you fit get the place fit dey red, mostly for people wey dey fair. You go notice that dem fit get swelling, then stiffness of that joint, because you know dey fit waka well with the leg. So that's the joint can be stiff somehow because wetin dey lubricate the joint don finish, so you no go get free movement. So because of that lack of free movement, and that go come dey cause pain, and that place go dey warm, go dey hot pass every other part of the body. So that na some of the things, some of the common symptoms, sorry, the common symptoms wey person fit see when e get arthritis. So I like to quickly rush talk wetin dey cause arthritis.
Dr. Israel, sorry, your network, I don't know what happened. Your network is breaking again. Just try exit and come back again. I don't know what happened. Yes, just try exit and join again. If you're just joining us, welcome. And so we talk about arthritis tonight, and Dr. Israel, they try list some of the signs and symptoms for us of arthritis. We don't talk about where arthritis they affect your joints in the body. We don't talk about the different types of arthritis. And Dr. Israel, if you can hear me, exit and then come back again, join. I don't know what happened to your network. So Dr. Israel now lists some of the signs and symptoms of arthritis. Pain around that joint. If you see the screen I shared to you before, you notice that somebody that has arthritis, you see the person complaining of pain around the joints. Then next thing you can notice again is that that person will tell you, say, that my joints don't swell up. That area where they are affected don't swell up. The joint with the joint. Some other people will tell you, say, that my joint enough move like how it move before. It dey stiff. So if you look very well, waiting they show for your screen, you see somebody we putting hand for in leg because it dey pain them. Now remember, say we tell you, say we get different types of arthritis. Some other type of arthritis, the person if he get fever. Yes. The person if he get fever, meaning say that part of the body feel even dey hot. But generally, the common symptom of arthritis wey we dey always notice, person go get pain, that joint go swell up, e go tell you say e no fit move that area, e be like say e dey stiff. Dr. Israel, welcome back. Can you hear me now? Oh my God. Oh my God. Oh boy. Dr. Israel, your network, oh, wetin dey happen? Okay.
I believe network.
My God, oh. Hello. Can you okay? If you can hear me, if you're watching me and you can hear me, put in the comment section. I can hear you. If you can hear Dr. Israel, drop in the comment section. I can hear Dr. Israel. Let's know where we're getting the problem from, because I don't know what is going on. Good evening. Welcome, welcome, welcome. I see you. Okay, good. So I spoke about the symptoms of arthritis and pain. I can hear you very good. Okay, Ben Juliet can hear me. And then I told you that that place can be hot. You can have fever. You can have swelling, and that joint can become stiff. Now let's talk about the common type of arthritis, osteoarthritis, the common one, osteoarthritis. Number one, osteoarthritis affects elderly people. As you increase in age, as you walk around, you go to work in the morning, you come back in the evening, you run, you play, gradually, I believe you can see what is on the screen, gradually, the joints gradually begins to change. Can you see the picture on the screen? Look at the normal knee, and then the other one that has arthritis. Gradually, these joints changes. All the normal ligaments, them, the cartilage, as the joint ages, they break down gradually. And then when you start walking, you notice that I feel pain. I can hear you, but Dr. Israel own is breaking. Okay, very good. Now I believe you can see what is on my screen. The reason I'm showing you what is on the screen is for you to follow me and understand and have a clear picture of what we are talking about. Jesus, my eye. So osteoarthritis occurs, number one, as you increase in age. Your joints also increases in age. All the normal ligaments, the normal cartilage, gradually, they wear and tear. Hope you can see what is on the screen. Very good. Now I want to show you more so that I hope they don't flag this up. Let's see if we can show you this again. Let's see if this will. Okay. Now look at this picture on the screen. Look at the healthy joint. Look at the space between this bone above and the bone below. Look at the one with arthritis, osteoarthritis. The space in between the bones, the space have reduced very, very well. So this bone above and the bone below, they are now touching each other. If you can hear me and you understand what I'm saying, say yes, I understand. So the bone above and the bone below, that space, that thing that protects these two bones from touching each other, what happened? They have what? Reduced in size. So the bones touch themselves. So when you walk, you feel pains in your joints. You say, I'm having pains. That is one sign of arthritis. Pain. Another thing again that can cause arthritis is what? Let's say you have injury in that joint. I understand you very clearly. Good. Now you can listen again. Listen again. We are not in a hurry to teach you about arthritis. We want you to understand because we are going somewhere. Your normal joints, when they gave birth to you, your joints were fine. Oh, you were growing, you were a young man, young woman, you were playing football, running, no pain. Gradually, as you started increasing in age, 30, 35, 40, 45, the normal joint changes. The cushion you have protecting this bone from these other bones, now they have reduced. Therefore, these two bones, they touch each other. Dr. Israel, can you hear me?
Yes, I can hear you. Can you
Okay.
hear me?
Now I can hear you loud and clear. Okay. 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 So let me round up, then I hand over back to Dr. Israel. So number one is what? Your age. Another thing again that can cause arthritis is injury. So let's say you fell, you were climbing the staircase and then you fell, and you hit your knee when you were rolling down the staircase, and you didn't take care of this knee very well. That injury can affect that joint, can damage the cartilage in that joint, and then over time you develop arthritis in that joint. Is it clear? Do you understand? Dr. Israel, over to you.
I just finished
Hello.
now.
Okay, make I finish am. You say make I just finish am. And you were talking
Because
no, so I you
of
stop. Yes, Alpha.
uh, uh,
Hello.
I said what?
Oh God.
Okay, I was talking about the risk factor. I wanted to talk about the cause, the what causes. Can you hear me?
Continue. Hello, Dr. Israel, continue.
So I want to talk. I want to talk about another. I want to talk about the way they cause, what cause the famous arthritis, the causes of arthritis. So
Okay.
the first thing we need to know. But sorry, I have to go like that because part my height. I don't know what's the problem there. remain with life. Okay, so for the cause of arthritis, majority of the different type of arthritis, majority of them get causes, but one of them, that is gout, it get cause. And what is the cause
Dr. Israel, your net,
of gout?
Dr. Israel,
Uric acid.
your network is still breaking. Oh, your network is still breaking. You say Dr. Israel's network, your network. Hey, ladies and gentlemen, see problem, eh? Network issue. Oh yeah, continue. Let's see, continue.
And I can hear you clearly. That's one thing.
Yeah, but okay, let's do this again. Everybody watching, if you can hear Dr. Israel, just comment, I can hear you. Oh yeah, let's go.
I don't think everybody can hear me because somebody already told you the Israel network.
It's breaking. Yeah, it's breaking.
Oh, it's breaking.
Yeah, it's breaking. Yeah. We can't hear him. Okay, we can't hear him. Okay, Dr. Israel, try change your location again.
No problem.
Okay.
So we continue.
We can't hear him. Oh my god. Oh my god. The network is bad. Dr. Israel's network is bad. I can't hear anything. Sorry. Ladies and gentlemen, sorry. Okay, so sorry. Sorry. Let me see if I can continue. Please don't forget to share this video. Share the video. Like and share. Okay. Now I told you about osteoarthritis. I told you what causes osteoarthritis. Your age. Now let me tell you about another type of arthritis that Dr. Israel was talking about. Gout. 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 Let me see if I can get a picture for you about gout, and I'll show you on the screen. So gout is caused by chemicals. When you eat food, or you consume alcohol, or your body breaks down. Oh my God! If you can hear me, and we are together, your body breaks down certain components in your body. It releases a certain type of chemical. This chemical can stay in your joints. We call them uric acid. Too much acid. So when your body produces too much of uric acid, this uric acid, yeah, I have a picture of gout, and I'm going to share with you on the screen right now. Oh my God. It's quite frustrating though, but let's see if I can do this for you. Dr. Israel, Alpha, can you hear me? Okay, so let me show you a picture of gout on screen. Dr. Israel, if you can hear me, please signify. Let's see if Dr. Israel is here. Dr. Israel. Okay, so I have a picture of gout on the screen. Look at this picture. So when you have too much uric acid, it develops in your joints. And the common joint that gets affected with uric acid is your big toe. Dr. Israel, Alpha. Can you hear me? Oh yeah, now let's go. Are we together? So you can develop gout when it affects your big toe. You have uric acid. Look at it, uric acid crystals. So when it deposits in this joint, you develop severe pain. Good evening, watching you live from Lagos, Nigeria. Okay, let's see. Dr. Israel. Oh yeah, unmute yourself now. Let's know if your network is back. Now, the other type of arthritis. Hello?
I can hear you, but I don't know if you can hear me. That's a problem.
Okay, I can hear you now. Oh yeah, continue quickly. Go ahead.
Okay, I was saying that because of arthritis, You know, for other arthritis, there's no known cause. But there's only one arthritis that there's known cause. The way you do your facilities, you know, them.
Continue,
There's no
continue,
known
but it they
cause.
crack not more. Continue, continue.
Okay, there's one, there's a known cause, which is gout. So and gout, which is really causes gout is increased uric acid in the body system. So when the uric acid is not many for the body system, what you do is that you go lodge for some particular part of the body. And one of the part of the body where it lodge put na joint. As of first August and big two, now one of the places where you go stay. And when you reach there, it will going to destroy those cushions when they help us to prevent those two bones to jam together. So you destroy them and you give way for those bones to come together. So that's the only one we get we really get possible. Yes, this one the thing with the cause. But every other one, like the osteoarthritis and all that,
Voila. Voila be like bicycle. Oh, Dr. Israel, what
that's
did
why
they
you have to
happen?
listen.
Okay, make I talk me they listen.
I don't know.
Okay, you got a comment. You got a comment.
Yes,
Okay.
yes, I
Anyone may
will
want.
comment.
Okay, you know how we want put them for the comment section and then try to change your network. Let's see how it goes. So waiting Dr. Israel, they try tell us, they say some of these arthritis, the exact cause, waiting they cause them, gong, we don't know. But few of them we know, like osteoarthritis, we know, like gout, we know. Rheumatoid arthritis, wetin dey cause rheumatoid arthritis na the immune system, your immune system, autoimmune disease. The person immune system, immune cells go just go dey attack the joint, go dey destroy the joint. The exact thing wey dey make am dey go destroy the joint also we never know. E dey make sense? We get different type of arthritis. We get another arthritis wey we dey call juvenile idiopathic arthritis. This type of arthritis na arthritis wey dey affect children also. Now, and another type of arthritis again, what we dey call septic arthritis, infection. The person fit get infection like bacterial infection. That infection go waka enter the joint. When e enter the joint, e go cause the person problem. Are we together? So whenever you use the word I get arthritis, you need to understand wetin you get. Who confirm the diagnosis for you? Na your neighbor, na woman for market, na your landlord, na your wife or your husband. You need a medical professional to actually confirm if true you get arthritis or not. And if na arthritis you get, which type of arthritis you can get. You don't understand? Now, osteoarthritis you get, will they affect age? Now, rheumatoid arthritis you get, now gout you get, now ankylosing spondylitis you get, or waiting you get. So, not just open your mouth and they talk, say, I get arthritis when you don't really know what you get. That's number one. Number two, how doctors they make diagnosis of arthritis. To make a diagnosis of arthritis, one, you go follow the patient talk, you interact with your patient. You go ask am wetin dey pain you, where dey pain you, when e start, how old you be, which kind work you dey do, you get fever, you understand, e don do anybody for your family. Why? You dey try to trace whether dem get any genetic linkage, whether somebody for family get am before. All these things na wetin go guide your doctor to arrive at a diagnosis. Then your doctor go come examine you. Oh, e go look your joint. Where dey pain you na your knee. This knee don swell up oh. This knee dey pain you. Na only one knee abi na the two knee dey pain you. E go come check whether the knee dey move, e free, e fit move. If e no fit move, e dey stiff. E go check whether the knee red, whether e swell up, whether e dey hot. Many things dey wey your doctor go examine. After e don examine you, Dr. Israel, abeg dey drop comment so that make I dey also read your comments. Very important, abeg. Then your doctor go come decide say make we do x-ray of your joints. So now I wan show you a picture of x-ray of joint wey get arthritis, so that make you try see how e dey be. If you dey understand wetin we dey try talk about since, put am down in the comment section. Everybody, so that make we know say we dey follow ourselves, we dey together. Just put am down. I dey hear you and I dey follow you. I dey hear you, I dey follow you. Okay, very good. So your doctor will carry out test for you. And then when they carry out the test, yes, I don't see one. Very good. I'll show you something here. Very, very correct. Let me show you one picture of a joint we get arthritis. So everybody, just look at your screen. One picture will come up very soon. You get many type of tests where your doctor will do, but one of them, your doctor will decide to also do x-ray for you. And when they do x-ray, look at the picture here. You see this picture, this one with red, blue and red of the knee. Look at the normal knee. Look at, see space between the two bones for x-ray. Look the normal other one beside the normal knee with red arrow. You don't see them? That space between the two bones don't reduce well. Meaning say these two bones now they touch each other. You dey see them? So I dey hear you. So Dr. Israel put comment here. Now, one comment with Dr. Israel put again. Now, some other things, risk factors, yes, very important. Good. I will explain on this. Risk factors of arthritis. I spoke about your age. And then for sex, which sex now they common with arthritis? Dr. Israel, put that in the comment section again. I can't remember. Then weight. If you dey obese, people wey dey obese, wey get large weight, they develop arthritis well. You know why? Their weight, they put load on top their knee and their hip. So when somebody dey obese, one complaint, really they always complain where you go, yes, doctor, my knee they pain me. I dey get knee pain. Why? That knee they carry load for the body. So obesity, excessive body weight, overweight fit cause you problem for your knee. Your lifestyle, the kind of lifestyle where you live. I know about smoking. Smoking fit damage your cartilage for your joints. Yes, okay. Smoking fit damage cartilage for your joints. Dr. Israel don't comment. And number two, and the kind of life, the kind of job where you do, if you be athletic, you do sports, people will do sports well, they feel they are at risk of getting arthritis because they use their joint well. You play basketball, you play football, you do sprints, you carry iron, you do gym. People they carry iron, they feel develop arthritis because of the kind of job where they do. Now, the next thing again for the screen, female fit get arthritis, rheumatoid arthritis, more than male, based on studies. You understand? And then some studies link say, bless not the female hormone and the other ones. They are among the things we cause them. Dr. Israel, let's see if I can bring you back up on the screen. Let's see. Oh, yeah, unmute yourself. Unmute your mic. I hear you, doctor. Okay, very good. Let's see if your network is okay. So unmute your mic and then say something. Maybe we see. So your doctor will come do it in. They will come do and test for you. Then correct for osteoarthritis. Now male they get and pass. That one no mean say female no they get them, but now male they get them. You know why? Because for our world, for this generation, now men they walk past women. We are not trying to be sexist here. Before you come go they drag, if you drag me, I drag you back. Now men they get them. Why? Because now men they work more. Now men they do hard labor job more. Before feminists now go come they drag us. Men now they do hard labor job past women, and you know it's the truth. men na them they carry all these heavy job, construction workers. Now men with this. So men they develop arthritis, osteoarthritis more than women. We know they come do sexist argument here. We're just trying to lay emphasis on the facts we have on ground. Uh-huh. Now man joints and a man they quick injure their joints pass. Very correct. Dr. Israel, please unmute your mic. So I believe you don't understand what we talk about. We no talk say women no fit get osteoarthritis. Women too fit get osteoarthritis, but it dey common more for man pass woman. Okay. Now, if you get questions for us on arthritis, they drop your questions in the comment section because we will take your question very soon. Dr. Adrian.
Can you hear me?
Okay, I hear you. Go ahead.
Okay. I know you don't give us history. Don't know who is being the doctor of know the kind of arthritis when person get. And apart from that, based on question when you go see ask family history and all that. So most of the time there's family history, you know, say now those autoimmune type of arthritis and that person will likely get. Based on what I already yes, rheumatoid arthritis and when they get them. Why for all type of arthritis and men quick get them. Then we get those juvenile type of arthritis and children and the quick next one the quick affect. So how do they treat this arthritis? We know say most of the time we say these things are not most of the time we go say this arthritis it is difficult to treat and difficult to treat, make your cure come on finish. Yes, say still we don't well what you need to do to
Network is bad though, Dr. Israel. Network is bad though. Oh my God. Okay, so I don't know if
I don't
you can go if continue. Say I don't rest. Okay, so drop in the comment section again on the treatment. I'm going to read your comment. No vex. So waiting Dr. Israel they try break down for us. They say the treatment for arthritis they hard. Some people they find permanent cure. Say doctor, which medicine I go drink make it cure my arthritis? Make I no lie you. For now, that medicine we go cure, we go make the arthritis just cure permanently. E never dey. Because arthritis, to treat arthritis, you go dey manage the symptom. You go tell the person, if the person gets excessive body weight, you go tell the person make e try control im weight. You go try tell am make e exercise. You go give am medications to manage the pain. But say if you drink this medicine now, that arthritis for the joint go disappear. I never dey. However, again, research is ongoing. They do research well, like stem cell research, some biological therapies wey dey go on to see whether they fit help people cure, treat the joints. One other way wey they take treat arthritis now surgery, operation. For some people, the arthritis can be so bad that they go need to change or which we they call joint replacements. They go need to change that joint. Knee replacement surgery. Now if you dey for you dey medically inclined, they fit help the person. That joint, if it don't bad well, they fit do surgery for that person, and then change the joint. Dr. Israel, can you hear me now? Go ahead, let's see.
I can hear you. I have been hearing
Okay.
you now, just so you know they hear me.
But yeah, continue. It looks clearer now.
Okay. And now, how we fit treat osteoarthritis? It can be surgical, but it can be medical. But the thing what you need to know is that in the treatment of osteoarthritis, sometimes not be to just make sure say
you well finish. I say your cure, mostly for the medical part of it. Now you should know, say when we dey talk about the causes of osteoarthritis, we talk say wetin cause arthritis. Now we say the things wey dey there don comot, don finish. So if you want make e go back to as e be, you need to put wetin don finish, you need to put am back. E just be like when you buy motor and you dey use your car, you dey match brake, the brake shoe, the brake pad, e go come fire finish. And when the brake pad fire finish, you know say that brake no go dey hold well. The only way when you go fit make sure say that brake come dey hold well na to replace the brake pad. Shey? So na still the same thing. So the main treatment for arthritis na to replace wetin don comot. So e mean say na surgical. However, because e no really dey easy to dey do surgery because of the so many factors, and so we go come dey look about medical medicine. So there are many drugs you fit dey take to reduce pain. That na one. So that if the pain not too dey there, you go fit dey do your normal activities. Another thing, we fit still give you some drug if na immune system dey cause am, to reduce those autoimmune activity, so that make dem calm down, make dem no dey cause too many damage to that joint. Then another thing wey we fit say make you dey do na physiotherapy, but not be strong one, simple physiotherapy movement. Most of the time, if people come meet me, they complain of those joint pain when I know say na arthritis. Sometimes I no dey too give them many drug, because make I no come say I dey try treat that one, come cause them another problem. So I even prefer them to use all this band to rub those part of the leg, because those can still help to reduce the pain in their joint and other. So those are like the medications that can be used in terms of managing osteoarthritis. Now, when we come to surgery, we get the joint replacement. So you need to replace the joint, that is, or fusion. Sometimes you just need to fuse the joint. So instead of the joint to dey move, you just fuse and make it stay one place. But you know, say not be every part of the joint you go want fuse. So in some parts you can decide to fuse it so it will remain like that. Then you know go dey cause you pain like that. Why if you decide to replace those things when you don't remove from the joint, you can also do that. All those one are the surgical way to take treat arthritis. Okay, now when we don't talk about the treatment, I hope say everybody they hear me this time. When we don't talk about the treatment, we will also talk about
yes, I dey hear you. Continue.
Everything when we talk about medical things, they always get prevention. I make in this nowadays not really they talk about cure treatment. Thing we try to move into now how to prevent all these things from happening. Those ones where we go prevent, make they prevent them. So even the arthritis, some of them they possible to prevent. So you can prevent some of them. So how can you prevent them? Now your lifestyle. So you see all those risk factors we mentioned, like apart from age, when we say that age, you know, prevent your age. Or every other lifestyle, we say smoking, drinking, obesity, those things can be prevented. Those they involved in too many kind of sporty activities. Those are things set up which we can do with osteoarthritis mainly. So if you find a way to reduce those stress to all your joints, and also for those way to cause that your size, reduce your size, and if you drink, you smoke, use all those things, it will help you in long way not to develop arthritis in any form. So those are just some few ways when we will prevent arthritis. So over to you.
Thank you so much, Dr. Israel. I struggled to hear you, but I could hear you. And we take some questions quickly because of time. So somebody asked us, Dr. Abeg, natural food or how can we prevent arthritis? So Dr. Israel don't tell us about what you fit do to prevent arthritis. That is number one. What you fit do. It tell you say your age, you know if you reduce your age, but obesity, your lifestyle, if you dey smoke, and the kind of job where they do all this thing, if you try modify and make you fit try. You understand? But some people go do all these things, if it still happen to them. Natural food day. Now listen, there's nothing like this is the food that you will eat and you will not develop arthritis. No. But this food, if you chop them, they fit support your body. They fit give your body the normal nutrients, all those nutrients wey go help your joints. Do you understand? No be say to avoid arthritis, go and eat this food. No. But if you eat this food, they fit support your body generally. Number one, you eat food like omega-3 fatty acids, like your fish. It go help your body. It go support your body. It go give your body the normal, you understand, those omega-3 fatty acids wey go also support your joints. Another thing again, food wey dey rich in calcium. You understand? Milk get calcium. Even egg get calcium. Exposure to the natural sunlight get an amount of calcium wey go give you for body. And that thing again, reduce processed food. All those processed food wey you dey chop, if you dey chop am too much, they fit give your body all those oxidants. These oxidants fit also dey damage your cells. So if you dey chop processed food, try your best to reduce them as much as you can. If you fit leave am sef, wonderful. And that thing again wey go tell you make you avoid alcohol. Because if you listen to us from the beginning, as part of the risk factors for one type of arthritis, alcohol dey involved. So if you dey take alcohol, gradually you dey spoil your joints, you dey damage your joints. Another one again, as Dr. Israel talk, na smoking. Smoking too go spoil your joint. Then that food again, our normal food, your fruits and vegetables, they contain certain type of nutrients too, wey go support your joints. I don't know if Dr. Israel get anything to add to this, so that we go to the next question.
No, that was the last time I talked before you come talk. All these things.
Okay.
So they are correct, and they are
Okay.
correct. So all this is really help you. So your fruits actually is very important. Banana.
Okay.
They will help.
We get another question here. If you get a question, ask us now. Doctor, please, I have swelling close to my shoulder level and hip, all at the left side of my body, which sometimes causes pain and sometimes affects my legs and hands, like giving a shock. And sometimes it feels like my what is about to get paralyzed. I went to the hospital and I was told it's arthritis, okay? Was given medication, but it's still the same. Please, do you have anything to say about it? Okay, let me say something and then Dr. Israel might drop one or two cents too to this. Now, if you listen carefully, what we said, arthritis don't get permanent cure, you understand? And now just management. You take your medications to relieve the pain will disappear, the cycle come back. So I don't know if your doctor no really explain to you, say the medicine wey he give you, the medicine no go make am disappear forever. Maybe you dey feel say if you take the medicine now, that pain go go totally. I doubt. You understand? You no go. So that is what I think is happening to you. And then, like wetin Dr. Israel talk, if you do physiotherapy, they help you massage and apply some analgesic cream to help relieve your pain. And furthermore, if you also see your doctor again for more review. Dr. Israel, you get anything to add?
Okay. I want, I don't really know the doctor when you see, but it will be very good if you see an orthopedic doctor, as doctor when they specialize in bone. So because you see all the shocking sensation, it means say it go on the affect your neck somehow. Eh? So if they affect your neck, it's not really okay. Now those swelling, you never can tell what kind of swelling are those. And those swelling I compress those nerves when you get when they there. So it is better you see your doctor orthopedic. If not orthopedic doctor, you first see go see orthopedic doctor. So now the orthopedic doctor now tell you what and what to do. If I'm meeting so they want to do surgery, you find out what they happen. Or if now waiting to maybe do extra, maybe say that's what they be. Maybe it is cancer. To see how the swelling be, how they compress or how they compress. And if therapy will be very, very good for you, you go see the best first see doctors wey specialize in home. And that one go say this is.
Okay, good evening, welcome. If you get questions for us on arthritis, please ask your questions. So wetin Dr. Israel try talk be say, if you never go see orthopedic surgeon, orthopedic surgeon and doctor wey dey specialize in the management of people wey get problems with their bones. Orthopedic surgeons go fit help you, go give you expert opinion, and wetin again you go fit do. They go check your joints to know what they go do to help you. So try to see an orthopedic surgeon if you never see an orthopedic surgeon for your treatment. Make it help you manage them. Remember, we tell you say permanent cure no day, but depending on what you get, your doctor will help you manage the symptom. We tell you what they cause arthritis. We tell you the different types of arthritis, and we tell you the symptoms. Who fit get arthritis? Why people they get arthritis? Nobody say you go just wake up, talk say, I get arthritis. So we get one question here. It says, I have weakness on my legs. For instance, when I stand for too long, my legs become weak. What can I do to strengthen my knee? Dr. Adrian, respond to this, please.
Okay, first thing now to know how old are you, because I know say that's a woman, but women so many things they involved in their joint pain and all those things. So how many years you dey? Is it your period, those things are things all things are things wey need to put to consideration. However, if you stand too long, e dey cause you pain. You cannot stand too long. So if you stand for some time, try for some rest down. And that one will help you to dey strengthen your leg the more.
Yes, thank you, Dr. Israel. If you dey stand for too long, from your question, when I stand for too long, so the best advice for you now, not they stand for too long. That is number one. If your knees are weak, that one are totally different stuff altogether. It is different. What is the talk now is different. Whether you stand for 5 minutes or 20 minutes, if the knee is weak, that is totally different. But if you know, say, now whenever you stand for too long, you get that problem. Number one, no stand for too long. Number two, if you get any medical challenge or any medical problem, if it they affect you also for your leg or for your knee. So we're going to need to be sure what they happen, why they feel, and also depending on your age. You understand? You know, we'll compare a 20-year-old man and a 50-year-old man where they complain of knee pain. You want to be sure of what they cause this knee pain for these people. So you know, if you use one complaint, they treat everybody. You must know more about that patient, a lot of things to feel help this patient. If another person come with that same complaint, what you go do for this particular second person go dey different from what you go do from the first person. So first of all, as Dr. Israel advised, not they stand for too long. Number two, We don't know more about you. We don't know your age and any other thing. So number three, weakness of your knee, they different from the complaint. So if your knees now they weak, that one they different. You will need more review. Make them check you to know what they happen. Sure you understand. Mhm. I hope it did clear. If you want more explanation, just put another question. Make we try break them down for you. But say you go drink this thing to strengthen your knee. We know if we tell you may strengthen your knee when we don't even know how the weakness of the knee they come about. Hmm? Yeah. Okay. Okay, usually you get anything to add because our time on the live session don't finish. As in, we don't even spend 1 minute more than the time. So we will prepare to round up. Yeah, thanks. Okay. So usually any final words?
Okay. Every time and recently now they always say thing. So that's why I move the watch our mental health. And today, one I want to talk now is say, I beg, learn and take answer to people when they talk to you because most for us, we the country Nigeria, a lot of us get too many things for our mind. So not say because you ask somebody a question, you not answer you well, to say it is sometimes see things say maybe this in the pass through one thing or the other, then make answer in that manner. And if there's any way we feel help anybody to put smile on somebody's face, I beg, try one so that everybody go dey happy together and because we dey happy, we dey try to maintain our mental health. Thank you. God bless you all. And always remember say no dey take you for granted. We always appreciate you for being with us every Sunday.
Thank you, Dr. Israel. Your network would be the crack from my ear. I don't know whether other people they hear you too. But we want this opportunity again. Say thank you. Remember, I beg, if you feel say you get arthritis, speak with your doctor, ask your doctor questions. Anything we know they clear to you concerning your joint, I beg, speak with your doctor. No, just go they buy medicine because as you they drink that medicine too much, that medicine itself it go cause you another problem for your body, just like waiting Dr. Israel talk. You understand? And on this platform, we did very grateful. Say you they come here, you they watch our videos, you they share the videos, you they comment. We don't take your presence here for granted. Like I always tell you, good life now waiting. Good life now sense. Thank you and have a wonderful night. We will see you next week. Take care and bye bye.